So what is obstructive sleep apnea? How does it differ from a regular snoring?
So if you really look at the differences between snoring and obstructive sleep apnea, there is one word that I would always like to say. Every snorer can be a sleep apneic, but every sleep apneic need not necessarily be a snorer, because there are other kinds of diseases where, in spite of there is absolutely no kind of air going in. For example, there is a condition called obesity hypoventilation syndrome, wherein they are not sleeping, they are awake, but their breathing is dysfunctional. So they don't necessarily have to be sleeping. But for a snorer to develop sleep apnea, they necessarily need to be choking in your sleep, resulting in a breathing disorder, which we call as obstructive sleep apnea. Obstructive means there is an obstruction for the free flow of air. Sleep means in sleep, and apnea is inability to breathe. So snoring can be a cardinal and essential sign for obstructive sleep apnea.